Everyone experiences stress and anxiety from time to time. They are natural reactions to stressful situations. For example, taking on extra work, speaking publicly, having relationship difficulties, or attending an incident. For most of us, the feelings of stress and anxiety pass once the stressful situation has passed. But for some people, around 1 in 4 Australians, the anxious feelings don't go away and become difficult to control. They feel anxious or fearful for no particular reason, which may start to impact on their ability to function day to day. This is known as an anxiety disorder. Let me go through some of the most common anxiety-related disorders. Generalised anxiety disorder is where a person feels anxious and worries excessively on most days over a period of at least 6 months. Panic disorder stems from a feeling of high anxiety, often accompanied by a feeling of excessive fear. Recurrent panic attacks are considered a panic disorder. Other anxiety disorders include specific and social phobias. Specific phobias include travelling on a plane, heights, or going near an animal. Social phobias include speaking or eating in public, feeling embarrassed or humiliated in everyday situations. Obsessive-compulsive disorder is characterised by repetitive thoughts and behaviours, such as constantly washing hands or clothes, or checking the doors and locks. The symptoms of anxiety can often develop gradually over time. It's important to be familiar with the symptoms and keep a lookout for the warning signs, such as excessive worry about common problems, increased heart rate, sweating, feeling apprehensive and tense, increased irritability and sensitivity to criticism, unable to finish work projects, difficulty concentrating or making decisions, not being able to sleep, increased use of alcohol and drugs, feeling overwhelmed and unable to cope, and obsessive thinking and compulsive behaviour. If a number of these symptoms persist throughout the day and interfere with your ability to manage at home and work, consider seeking help from a doctor or psychologist.
Hi, I'm Dr. John Kenworthy and welcome to the short tutorial on your brain on anxiety and stress. It is essential to know how our brain responds to the stimuli which trigger an anxiety response so that you are equipped to deal appropriately with anxiety. Let me highlight the key areas of your brain that are involved, and then I will explain what happens inside the brain. The thalamus is the central hub for sights and sounds. The thalamus breaks down incoming visual cues by size, shape and colour, and auditory cues by volume and dissonance, and then signals the cortex. The cortex then gives raw sights and sounds meaning, enabling you to be conscious of what you are seeing and hearing. And I'll mention here that the prefrontal cortex is vital to turning off the anxiety response once the threat has passed. The amygdala is the emotional core of the brain, whose primary role is to trigger the fear response. Information passing through the amygdala is associated with an emotional significance. The bed nucleus of the stria terminals is particularly interesting when we discuss anxiety. While the amygdala sets off an immediate burst of fear, the BNST perpetuates the fear response, causing longer-term unease typical of anxiety. The locus coeruleus receives signals from the amygdala and initiates the classic anxiety response: rapid heartbeat, increased blood pressure, sweating, and pupil dilation. The hippocampus is your memory centre, storing raw information from the senses, along with emotional baggage attached to the data by the amygdala. Now we know these key parts, what happens when we are anxious, stressed, or fearful? Anxiety, stress, and of course fear are triggered primarily through your senses. Sight and sound are first processed by the thalamus, filtering incoming cues and sent directly to the amygdala or to the cortex. Smell and touch go directly to the amygdala, bypassing the thalamus altogether. This is why smells often evoke very powerful memories or feelings. Any cues from your incoming senses that are associated with a threat in the amygdala, whether that threat is real or not, current or not, are immediately processed to trigger the fear response. This is the expressway. It happens before you consciously feel the fear. The hypothalamus and pituitary gland cause the adrenal glands to pump out high levels of the stress hormone cortisol. Too much cortisol short-circuits the cells of the hippocampus, making it difficult to organise the memory of a trauma or a stressful experience. Memories lose context and become fragmented. The body's sympathetic nervous system shifts into overdrive, causing the heart to beat faster, blood pressure to rise and lungs to hyperventilate. Perspiration increases and the skin's nerve endings tingle, causing goosebumps. Your senses become hyper-alert, freezing you momentarily as you drink in every detail. Adrenaline floods to the muscles, preparing you to fight or run away. The brain shifts focus from digestion to focus on the potential dangers, sometimes causing evacuation of the digestive tract through urination, defecation or vomiting. Heck, if you're about to be eaten as someone else's dinner, why bother digesting your own? Only after the fear response has been activated does the conscious mind kick in. Some sensory information takes a more thoughtful route from the thalamus to the cortex. The cortex decides whether the sensory information warrants a fear response. If the fear is a genuine threat in space and time, the cortex signals the amygdala to continue being on alert. Fear is a good, useful response essential to survival. However, anxiety is a fear of something that cannot be located in space and time. Most often, it is that indefinable something triggered initially by something real that you sense, but that in itself is not threatening, but it is associated with a fearful memory. And the bed nucleus of the stria terminals perpetuate that fear response. Anxiety is a real fear response for the individual feeling anxious, and anxiety can be debilitating for the sufferer. Now that you know how anxiety happens in your brain, we can pay attention to how we can deliberately use our prefrontal cortex to turn off an inappropriate anxiety response once a threat is